There are numerous strains of E. coli. Numerous strains, and of those numerous strains, most of them don't cause us any issues. You've probably ingested some of them today and didn't know it. But there are a few of the strains that have major impacts on our health. Some of them can cause death. One of the big ones that we've talked on an earlier lecture in this chapter, E. coli 0157H7, also known as the Shiga toxin E. coli, STEC. You'll see the acronyms for the different E. colis that we need to watch out for will be spelled out in acronyms. STEC, the Shiga toxin producing, is the most virulent. Okay, think what was a decade or so ago, the Jack in the Box, people were eating E. coli contaminated beef in their hamburgers that were undercooked. The undercooked beef carried STEC, the Shiga toxin producing E. coli, and it resulted in numerous deaths from dysentery, bloody dysentery, and shock. Somewhere along the way, a strain of E. coli gained the genes responsible for the production of Shiga toxin. Either it was direct conjugation with Shigella dysentery, or it was a phage infected Shigella, and then one of the phage daughters, remember, one virus goes in, hundreds, thousands come out. One of those hundreds or thousands, pulled apart of the Shigella chromosome along with it, because it was, the lysogenic cycle. And then it went and invaded into E. coli. Now, when it comes to symptoms, initially, upset stomach, lots of pain, lots of bloating, some diarrhea, maybe a slight fever, vomiting, gastroenteritis. You go see a patient like that in a clinical setting, and that's all they've had for a day or so. You're not just going to tell them to wait it out. But minority of the students, small percentage of of the patients will develop what is referred to as hemolytic uremic syndrome. Okay, they're going to start bleeding into their large intestine. It's going to start leading to anemia. It's going to start lead to their nutrient levels, their different mineral levels, salts, and all that stuff. Their electrolytes, I guess that are called, their electrolyte imbalance, which will ultimately lead to kidney damage, which that damage will accumulate, lead to failure, and once the kidneys go, other things start to happen. You're going to get some neurological issues. You're going to start to get to metabolic issues throughout the body, and different things happen. The E. coli itself doesn't really make very many, if any, virulence factors. I mean, LPS, that endotoxin, seems to be the worst, that E. coli on its own. Here, the virulence, this extreme pathogenicity, is going to be due just to the presence of the genes for the Shiga exotoxin. No Shiga genes, no toxin, extremely low virulence, extremely low on the pathogenic scale E. coli. As I stated in the first slide on this mini lecture, beef seems to be our main source for exposure to STEC during slaughtering of the cattle. Okay, the cows go into the slaughterhouse. They're supposed to be stunned, killed, bled, and then they go and they start, breaking down the carcass. While they're breaking down the carcass, they are supposed to minimize any and all chances of perforating the large intestine. Turns out STEC can colonize the large intestine of cattle. So if they perforate the large intestine and the contents gets on the meat, they're actually supposed to decontaminate, and in some states, some areas, they're supposed to throw that entire carcass out. Other states, other countries, they say just decontaminate and move on. Recent, I use the Jack in the Box. That was, I want to say, early 2000s up to, or mid-noughts, 2005-ish, around in that time. More recently, Chipotle had some issues with people getting very, very sick. I can't remember if there was any deaths. But E. coli, what is that, O26? Okay, that's a different O serogroup that happens to be a Shiga toxin producing group here in the US about 5 years ago. Again, you have to culture, you have to isolate from a stool sample, and you have to test for the presence of. Is this, STEC? The lab at the hospital, the ID lab will start the identification process, but a sample will need to be sent to the state local, because if one person has been exposed through fecal contaminated food, there's a chance that there will be other people, and they need to get to them before they get too sick or before anybody else can be exposed, because an immunocompromised person could succumb to the infection at a much greater rate than a healthy individual. Prevention, basically, it's good hygiene in the kitchen. Practice good hygiene. And this is the reason why they say if you're eating hamburger, make sure you eat it well done. Okay? All that surface area and the ground up meat that may have had, fecal contaminant on it gets ground in. So yes, you've cooked it so the surface of the hamburger patty is nice and charred, but the interior is still cold and pink. Well, STEC, that E. coli, is still there and still doing well. It's counterintuitive, but they say to limit antibiotic use here, because the antibiotics you would use to treat E. coli would wipe out all of the normal flora of the large intestine, given STEC full reign to completely colonize the patient's large intestine. If it happens to be even a little bit resistant to the antibiotics you use, thus exacerbating the patient's disease. First off, supportive therapy, plasma transfusions, okay? Dilute any of the toxin, okay? This is, if they're starting to suffer from toxemia, don't just put it in saline, start introducing plasma because they are bleeding. So you want to get more blood products back into their bodies. Now, there are other E. coli's. There are a total of 6 E. coli's that we focus on when it comes to diarrheal diseases. First one being the Shiga producing. You have enterotoxigenic, enteroinvasive, enteropathogenic, diffusely adherent, and enteroaggregative. Each of these is going to have its own characteristic means of attachment and doing damage. Okay. These 5 listed here do not produce Shiga toxin. If they produce any type of toxins like the enterotoxin, the enterotoxigenic, the ETEC, they have a different source. I do believe the enterotoxigenic E. coli produces the typhi, the Salmonella typhi toxin. Each of these has abilities to adhere to the surface of your large intestine, the epithelial lining of your large intestine, and produce different enzymes and different compounds that will alter the architecture of the tissues, increasing, decreasing metabolic activities leading to diarrhea.